Moving on. Vestibulo, spinal tract. Spinal tract. It is two. One is medial, one is lateral. Medial vestibulo-spinal tract, known as the lateral vestibulo-spinal tract. And regarding this site of origin, when look for the lateral site of origin, it's originate from the primary motor cortex, and supplementary motor area, like this is midbrain, cerebrum, midbrain, pons medulla, and this is spinal cord. So it's originated from the primary motor cortex. And when we discuss regarding the medial vestibular spinal tract, it's originate from inferior medial and inferior vestibular nuclei in medulla. And inferior vestibular medial, and this both vestibular nuclei bilateral thoracic region of the spinal cord, and lateral vestibular nuclei give rise to the lateral vestibular tract, and these descend ipsilaterally, like this lateral ipsil going below ipsilaterally on one side, like when you look the two portion of the spinal cord, and it's go like this way ipsilaterally from one side, and like lateral go at the lower limb region, and the medial go at the upper limb, like cervical region. It's going in the lumbar region, and this terminate in the same side of the nucleus, like anterior nucleus. And termination like medial, this is medial vestibular spinal tract, and is terminate at the cervical upper thoracic region, upper thoracic cord, and the lumbar lateral entire cord. It's present in the entire cord. And when look for the function, this is lateral. When look for the function, this is also lateral. So when we look for the function, lateral help to the balance, but medial help to the positioning of head and neck. Medial vestibular tract. This is regarding vestibular spinal tract. So now moving on the reticular spinal tract. Reticular spinal tract. And we further we have discussed like reticular spinal tract, and also we have discussed like tectoral spinal tract. So moving on, and also we can look in this reticular formation. There is a reticular formation. From the reticular, there is like medial reticular spinal tract coming out, and it's terminate at the anterior half of the all level of the spinal cord, and give the secondary the peripheral nerve or secondary nerve. So reticular spinal tract, like its formation, when we look at its formation, it is pontine. Origin is in the pontine region, pontine and medullary formation, and like there is no site of dislocation, so it's go uh, through the spinal cord and is terminate at the level of, it's present in the entire cord, and there is no any termination, so you give the all the level of the vertebra, sorry, all the level of the spinal cord, and its function is automatic posture and gait related movement. Now moving for the tectospinal tract. For the tectospinal tract, we don't have to discuss. So regarding tectospinal tract, tectospinal tract, midbrain of the superior colliculi. This is midbrain of the superior colliculi, pons medulla, and midbrain of superior colliculi. There is a tectum, and like there is, when it come in the like dorsal tegmental decussation, and in the midbrain, like in the midbrain, and it's terminate at the spinal cord, sorry, cervical cord region, and its function is like coordination of head and eye movement uncertain in human, uncertain in human. This is all regarding the descending tracts, so we discussed. Now moving on for the ascending tract, which are sensory, and we discuss brief in the next video regarding this.